all the other categories.
Do you disagree with the CBO's assessment that 24 million Americans will lose health care insurance?
I think it is wildly speculative, Joe. If you dig down, as the Galen Institute and others have done, into the CBO score, how do they come up with these numbers? For instance, one of them, several million, they assume that if people are no longer required to by the individual mandate, they'll decide to abandon free Medicaid. So you have free health care for your family under Medicaid, but if you're not forced by law to participate, I'm out of here. I think that's implausible at the very least.
So if you can't speculate on the CBO's numbers, can you tell us what the numbers are? Are you concerned?
Look, I look at the substance of this. What are we doing here? What are we doing? What we're doing is we keep the entire program intact. We keep the new eligibility category intact. We ask the states to pay their share, but we do one other thing that I think is maybe as important as all the rest. In the 8th year, we actually require that the program begin to grow at a slightly slower pace so that we have a chance of actually keeping up with this. Joe, you know, I've always been concerned about the growth of our entitlement programs. Right. They are driving the fiscal train wreck we're on. Medicaid is the single biggest driver of this. Medicaid is the single biggest driver of this. And someone needs to tell me, what is a more responsible reform for a giant out-of-control entitlement program than a slight curb in the rate at which it grows at a point in the distant future?
Why aren't we doing